Okay, so when setting up a Department of Labor agency, a few things under the settings that you'll want to pay particular attention to would be your product and services list. Typically, you will want a home health aide, visit note, and potentially a private duty nursing assessment and private duty nursing or skilled nursing shift note. And to set those up, you'll just hit the plus button here to add a new service code, or you can click on the service code that already exists in the system. It will be a service, which means that it's an appointment that will be on the calendar, and it is sold to clients so that we'll be able to invoice for it. You can give that a name that will show up on the calendar. You can categorize it. That helps. Service categories help for reporting and tracking and filtering purposes. You can enter a default length. So when you schedule, if you set a visit to start at 9 o'clock, it'll automatically set the timeout to be 9:30. So you can change that for each of your services if you have different default service lengths. And if you want to have an easy way to visualize visits, different types, appointment types, you can actually change the color. You can set the default color for your different services here. We will come back to the income items in a minute when we go through the billing side, but the income section is where you'll set up your medical billing information. The expense section is where you'll set up your payroll information. Tracking is not going to be really applicable for what you're doing within the Department of Labor unless you require a supervisor to co-sign on a particular shift note. If that's the case, you would turn on this supervisory signature option. The main thing you'll deal with is under advanced, setting up your clinical form, the document that will get completed when this appointment type is scheduled. We have like 100 default system forms that you can utilize. You can also create your own custom forms. But for Department of Labor, in this case, we'll choose a home health aide note. You can also choose either a private duty nursing note, which is designed to be a shift note, 8 or 10 or 12-hour shift notes. And you can also have skilled nursing, which is designed for intermittent visits, like 30 minutes to an hour visits. You can choose those from the list. For your routine shifts, meaning not an assessment or a reassessment, you can limit your services by the service types that your employees can choose underneath this list here. So in this case, for a home health aide visit note, we know they're only going to be doing routine shift visits, so we'll set that up here. We will QA each of those notes before they're able to be billed. And we set that up to review or QA 100% of the notes. You can modify that as necessary if you want to cut down on the amount of QA that you have to do for pre-billing purposes. You have several options here for that. And then status once validated. So once this note passes the QA process, we're going to put it into confirmed status, which means confirmed status means that the visit note is ready to be billed. If you have visit types like a PDN assessment that you can't bill for, that you just need to write off, if you ever set those services up in the system, you would change this status to revenue adjustment so that the nurse can still complete the assessment, but when it's passed through QA, rather than going into the billing system, it will go into a write-off status. Since we do want to bill for this home health aide visit appointment type, we'll set the status to confirmed. We will activate the visit appointment type by setting it to active. And then to ensure that only home health aides can be scheduled for this type of service, we're going to limit the appointment type to only home health attendants. You can leave that wide open, but as you grow, it makes sense to limit those appointment types just to make scheduling easier. You'll also need to set up Department of Labor underneath your payer code list. We give you a default list of payers, but you can delete those out if you only bill the Department of Labor. Um, Same as before, it's fairly self-explanatory on the setup of this. Once if you're familiar with billing, um, healthcare claims, you'll have all of your claim information available here under this setup. So for billing electronic claims to the Department of Labor, I believe they use a CMS 1500 claim form. By default, those will get created as electronic claim files. If you would like to print out the 1500 paper form, you can select not send them electronically and just have those print out as the actual hard copy. Note, all of your other claim indicator information is available below here. And so we'll leave that um, up to you to set those up. But if you're not using a submitter, if you're just going to create those within the software and download them, then you can leave most of this information blank. So you'll set up Department of Labor as a payer. You'll also set up your physician list. Again, very self-explanatory. Just click the plus button, add in your physician information. If you need to keep track of pharmacies or referral facilities, other provider types that you work with, you set those up here under these lists as well. Now, while we're here, I do want to point out a few other lists that will become valuable to you in the future. When you go to create your plan of care for your patients, you can manually create those, but you can also set up default master list. That's done here under these custom problems. And so let's say you often treat patients who have like gait abnormalities, and you want to create a custom care path that can be reutilized for each of those patients. If you come into the custom problems section, you can actually create a new problem. So let's say, I think let's try impaired mobility here. You can set that up as a custom problem, and then you can select the service categories that this problem would be used for. So in this case, we're doing physical therapy and skilled nursing. And then you can set up your default goals and interventions. And so maybe with impaired mobility, we would like the patient's goal to be increase stability when walking. We can add that here. You can add in all of your extra texts. And now that will be available underneath our care plan when we go to set this up under the plan of care itself. So now let's actually move into utilizing the system. And the first thing we want to do is make sure our employees are in the software. And so that's available under the employees section. Just hit the employee bar there, the plus button to add a new employee into the system. So here's where you'll add in your nurses and your home health aides, and you'll give them a title. This title is what will show up on their e-signatures. So in this case, if we let's if this person logged into the software and e-signed a note, their signature would say Henry Test, commas CNA. And then for filtering purposes, like we saw earlier on that when we set up the appointment type, if you in order for this person to be scheduled for the home health aide visit note, they need to be set up as a home health attendant here in the system. The rest of this information is fairly self-explanatory. You can put in their phone number, their email address, and you'll notice that the system gives you an applicant access button. That's because we typically anticipate an employee coming through our onboarding process. And so without a date of hire, we assume that this person is an applicant who needs to be in our applicant portal to fill out their new hire paperwork. In the case of an agency that's just moving to our system and you already have employees, you can skip the applicant portal process by just from the very top, go to the financial tab and go ahead and set the primary status of the employee. Tell us whether they're full-time, part-time, contract, and put in their new hire date, their date of hire. Once you have that, the system now recognizes this employee as as being hired rather than an applicant. So when you go back to the demographic tab, you'll notice that the applicant portal button has been removed and the security group field has been displayed. If you want to give this person access to our software, all you have to do is assign them to a security group that controls their access to the software, and then hit the save button. And when you do, our system will automatically email them their login credentials. And so now that our employee is in, the next thing to do would be to add our patient into the system. Very similar, just click the patient name. It's all very straightforward. You just assign them to one of your offices if you have multiple. If you have a large office that's broken out into subsections or what we call territories, you would assign the territory of the patient, put in the patient's information, first and last name, address, city, state, zip, phone numbers, active, their admission date in the software. The rest of these things are all fairly straightforward. You have if you want to track referral information, like who sent the patient over to you, that's on the referral tab. The contacts tab allows you to enter their primary physician, their pharmacy, the case manager at your company who's responsible for taking care of this patient. The primary employee, if you have an individual nurse or aide who sees that patient, this just helps you default that employee onto the schedule. So you can control that here as well as on the schedule itself. The service tab allows you to set up some of their default clinical information. If you wanted to set up their case level for reporting purposes, or their code status, or their triage level. Again, most of those are for reporting purposes. You can also set up some default plan of care clinical information, like their DME and supplies, or safety information, nutrition information. You can set all of this up as part of the assessment visit as well. But if you're not doing the assessment visit through our software, you want to speed through the setup of a new patient, you can add that information directly on the patient profile. Same thing goes for their medications. If you want to create medication profiles underneath the patient, you can do that. Putting in their primary diagnosis code and other diagnosis codes is available here, as well as selecting their OBQI risk. And then for billing purposes, you'll go to the financial tab, and for their primary insurance, that's where you're going to select the Department of Labor, which I don't have one in our test system here, but you would just select that payer from the list. It'll ask you for the patient's admit source, type of admission, etc. Put in their contract dates, when they're eligible for this insurance, their Department of Labor member ID number, and any other insurance information that you would need, and then just hit save. Now that we have that patient in the system, if we go back to them, we can create their plan of care by going to the order tab. and hitting the plus button. And for you as in the Department of Labor, if you have nurses who are going to be seeing this patient, you'll want to create a plan of care. If you only have home health aides going and seeing the patient, you'll want to create an aide care plan. They're just the plan of care is just a more advanced flow sheet functionality. The aide care plan is fairly straightforward. We'll do that one first. So it's an aide care plan. We will put this as the daily care plan for this patient. The dates when it will be in effect, frequency, any kind of other like safety precautions, allergies, and hit save. Once that aide care plan is in the system, then you can go back into that. Let's see here. For some reason I don't have access to it. Close this real quick. You'll have access to this task section. And this is where you'll actually set up what task the aide will see when doing their shift note. And so if you want them to do ambulation assist with the cane each visit, let's say we want them to encourage repositioning and transfer assistance, want them to clean up their feeding supplies, do a bed bath, remind about medications, check on their nutrition. Let's encourage fluids and do meal planning, assist with dressing if they're in the morning, check pressure areas in the morning. And so you can set each of those up. That's going to show up on the aide care plan here in just a minute. And so now that our aide care plan is set up, now when we view our patient, we can go to their schedule. Let's add in a new aide visit. So we'll do this one at 1 in the afternoon. You'll notice it sets that to a 30-minute visit by default. Since we set that up under our service code, you can change that from here if you need a longer or shorter visit. Select the employee who's going to perform this visit and hit save. And you'll notice it's letting me know that I can't assign myself to this visit because I'm not set up as a home health aide. So let's go fix that real quick. Just go to my account. And I'll set myself up as a home health aide attendant as well. Let's reschedule that. And there we go. Now you'll see that on the schedule. Since I have this scheduled to myself, I do want you to see for your nurses or aides who log into the system, as soon as they log into the software, they're going to see their visits for the week on their homepage. So they can always access the visit notes that they need to complete directly on their individual calendars. And so as the home health aide here, now that let's pretend I'm out in the home at this point, I will go ahead and hit the visit there. It lets me see that I've not completed my documentation, so I'll click there to actually do my documentation. First time they log in, it'll ask them if to let us track their location. That will get kind of the GPS coordinates or the IP address coordinates for the visit where they're at. So we'll know that they were in the home at the time of doing the visit. And then you'll notice the visit information is right here. On all of our point of care visits, you have the patient information at your fingertips. You have their previous medical records. You have access to their medication profile. You can add new medications by clicking the plus button and adding those in. You can add new files or attach files to this visit by going to the Files section. And then we want to start the visit. We'll start it at 1 o'clock here. And after we hit save, it changes that category to show that it's green. And then we can move on to the next section. And so do a quick pain assessment. Any comments on their current health. And then for aids, we have if you do have a plan of care set up for this patient that have very specific interventions outside of the aid care plan, those will show up here. Most of the time, your aides are only going to be working off of their aid care plan, and that's what shows up here. So earlier when we set up that aid care plan, you'll notice that those items are automatically on our home health aid note. So it told me to check pressure areas in the AM and assist with dressing in the AM. But now that we're per visit, we have some planning. Say when we did that, the time it was completed, and hit submit. And you'll notice that it automatically fills that out here. And so our aid is it just walks them directly through what they're supposed to do on that shift. And at the end of the shift, they would come in here. They can get their patient's signature by signing on the screen. The employee will sign off on the note and say who they turn the care over to. And when we're all done, we'll hit save and submit. The system will validate to make sure all the appropriate information is there. Let them know if there's anything that they've missed. And when they're done, they can hit submit. The system will get turned into QA. And you'll notice now on our calendar, when we look at that visit note, the system automatically changed the status of the note to unconfirmed. It was originally in scheduled status, which means that it's on the schedule, but it has not been performed yet. When the nurse or the aide completes the visit and turns it in, the system will automatically change the status to unconfirmed. So that means it's been done, but it has not been QA'd. It's not ready to be billed yet. In a second, when we QA the visit, the system will automatically change the status to confirmed, which means that it will be ready to be built. Okay. So you can always tell from the calendar by looking at the color scheme of the text, what the current status is. All right, so now that that's turned in, let's put on our QA hat. Those notes are automatically going to go into our QA section under care validation. This is our pre-bill functionality. And so here, you notice here's our visit, our home health aid visit. It was turned in today. I can click on that visit and get a summary of my patient. I can click the magnifying glass to go into the visit note and see what my aide had completed. I could print the visit note. This is what the hard copy note itself would look like for our medical records, or what we're going to send to the DOL later. If I needed to co-sign that note, we would have that option here. And then if I need to send it back to the aide, let's say that they had forgotten some information, I could do this. I can say, you did not complete some of the task. And we'll turn that back. You'll notice it's returned. It comes off of our list. So now the next time our home health aide logs in, you'll notice that they'll see that they have visits that have been filled back to them. If they go into that note, it lets them know what happened. And so they can come back in now, finish up some of this information. And turn that note back in. Now back in QA, we should see that. Not sure why that didn't come through for me. Confirmed. Not sure why that's not showing up. That should be here in my care validation screen. I messed something up, I suppose. But if it was back in my list this time around, all I have to do is pass that visit, hit pass. That will automatically set the status of the visit to confirmed, and it will be ready to be billed. Okay. All right. Real quick, just to run through the basics of the billing system. Once a visit is ready to be billed, all you have to do, you'll go to finance and create invoices. If you leave this filtering section wide open and hit submit, the system will go out and find every visit note that is ready to be billed and automatically create that claim for you. Those are called pending invoices. And so you can review those here. If you wanted to actually go into the claim itself, you have your patient information. We'll generate all of the info for your claim. You can come in and look at that and make modifications if you need to. But it should pull in all the information that you need by default. Your insurance information automatically gets pulled in. If you have an authorization, that would get pulled in as well. The items that are going on the claim, in this case, a home health aide visit. If you wanted to look at it, the HCPCS code and revenue code and charge amount that are going to get billed. If that all looks good, you can just hit confirm. That will create the invoice if there's not an error. And if you have electronic billing turned on, that will give you a claim file that you can submit. Otherwise, you can go back into the claim itself. And for Department of Labor billing, what you're most likely going to be looking at is, if you're wanting to do this without a clearinghouse, once you go back into the invoice, you can go to more and say print attachments. And the system will give you the invoice as well as in all the individual visit notes that are attached to that invoice. And so most of the time, I think with the Department of Labor, you would send in the invoice itself and the individual visit notes. And so you can do that directly from this screen. So you can print out the hard copy of your claim file and download it as a PDF. And you can also print out a hard copy of the visit note, download it, and create a zip file to send over to the Department of Labor. All right, I'm going to stop there for just a second and see, do you guys have any questions or anything you want me to go over?
Hi, I do have a question.
Okay.
For the price per unit, is there a way that we can put that in according to the procedure code? That way it can be automatically calculated by what the caregiver marks down on their notes, or is that going to have to be calculated by us each submission?
So let's run through a few things here. Under settings, when you set this product up, so let's say the home health aid, under income, default invoicing options, you can set this up. If you have multiple payers, you can actually set up individual service pricing for each of them. If you're only serving the DOL, you can set this up here. Show you what that looks like. You would put in your HCPCS code here, the revenue code, any modifiers, and then your charge amount, which is what's going to go on the claim. Let's say you wanted that to be $23.80, and you want that to be in 15-minute increments, so you'll choose unit, and then tell us how you want us to calculate the billing quantity. So in this case, if your home health aid is out there for 45 minutes, we will automatically bill out 3 times that dollar amount. Okay. And so what will happen is once that charge amount and billing quantity calculation is put in, when you schedule the visit, you tell us how long the visit is. When the aide is out in the home doing the visit itself, when it was scheduled for 30 minutes, she's actually going to put in her time in and time out during the visit. And so if that does go over, let's say that we scheduled it for 30 minutes, but she's actually there for 45 minutes, when that passes through care validation, we will automatically update the scheduled charge to be 45 minutes, and your invoice will automatically be adjusted to calculate that extra amount. So you'll always be able to see, like in this case, we set it up at $13.50 a unit. Because it was a 30-minute visit, then we automatically calculated 2 units, the total bill being $27. Does that answer your question?
Yes, sir.
All right. All right. Anything
I have
else?
a quick question. Yeah, sometimes our caregivers don't necessarily do their notes and stuff when they're at the client's home. They might be at home. So does the GPS or the in and out time, is that affected if they wait until days after the visit to complete the note or something like that?
So I would add some caveats. They can definitely do that. When they start their visit, they will have the ability to manually change the time. Okay, I think it defaults actually when they start the visit, but they can change the time in and time out on the actual document. They cannot change the date. Okay, if they need to change the date of service, you actually have to change that on the calendar itself. So if we schedule this for the 3rd, but they don't actually do the visit on the 3rd, they did the visit on the 5th. Again, not to be clear, not the not the time or not the date that they're actually doing the documentation, but the date that they were doing the visit. So if they wait until the 5th, but they actually did the visit on the 3rd, they're still okay.
Okay. Yeah,
and
that's what I was meaning. I just wanted to,
Yeah.
because sometimes they'll do their visit and take like brief notes, and then they'll come back and actually do the note another day.
Yeah, so
Okay.
that's fine. Just, when they come in on the 5th, even though they did the visit on the 3rd, they just click on that visit and change the time to what they actually did. As far as GPS is concerned, we don't print that on the visit notes. That's really designed for your own purposes, for more for like QA and fraud and abuse. If you wanted to monitor that, you'll have, I was trying to find a visit note that was done already. Once the visit is done, if it's done through our point of care program, if you ever need to track that, you can go to more, and we have an info button that shows you what's changed or who's changed information on the visit. If it goes through our QA process, you'll actually get another couple of options that show how the point of care documentation itself was completed with a GPS indicator next to it. So again, it's not used for billing purposes. It's not displayed to anybody, but it is there if you need to. If you question whether someone's actually going out to your patient's home, it can help give you an idea of where they're doing their documentation. All right. So I know that's a lot of stuff to go over, but hopefully that gets you started in the system.
Yeah.
And then we actually have a full day of certification training coming up on the 11th. If you guys need extra training, that's a free 1-day basic certification course that will cover all of this stuff, but in more it's more in depth on the actual, like the rest of the system. It's less in depth on like Department of Labor specifically. It just kind of addresses how to run your whole business, but that is available on coming up, I think, on the 11th.
Do we have to sign up for that, or how would we get that?
We'll send out emails to everybody, but it's also on the website. So we'll get that to you.
Perfect.
Thanks, Jack.
Absolutely. You guys have a great afternoon.
Thank you. You too.
Bye, guys.
All right. Bye.